Hello everyone, how are you? In the previous lecture, we discussed about the pilonidal sinus. That means what was the definition of the pilonidal sinus, also the clinical feature and the development differential diagnosis. And today we will discuss about the treatment. So treatment is very important in case of the pilonidal sinus, and today we will discuss details about the treatment of the pilonidal sinuses. So what may be the treatment option? First of all, let's see these are the treatment option of the pilonidal sinus. First of all, this is the conservative. So we can treat the pilonidal sinus by conservative method. That means without surgical approach we can treat the pilonidal sinus, and also we can treat when there is the abscess formation. That means in case of the acute formation, also acute condition, and also the surgical treatment requires in case of the chronic pilonidal disease. So in case of the acute pilonidal disease, there is the one type of treatment, and in case of the chronic pilonidal sinus, there is the different type of the treatment. So what is it? And the another one is the conservative. That means in case of the small pilonidal sinus, that means the simple pilonidal sinus or pilonidal sinus of the single opening or pilonidal sinus which is very smaller area, in this condition conservative treatment is possible. So first of all, this is a snapshot directly taken from the Bailey Lab. You can see the Bailey Lab 28 edition, these all are present. So, and it will be very helpful for you to read. And let's see the conservative treatment option. The nasal history is to regress over time. That means the pilonidal sinus, which is smaller in size, usually they regress over time. That means spontaneously recover. But we can take some specific measures, such as in case of the minimal symptoms. So what are the actions? The actions, first of all, the simple cleaning of the tract. That means the cleaning of the tract, then the removal of the wall here, regular hair exfoliation, and strict hygiene. So it is the first conservative treatment. So what is the first conservative treatment? The first conservative treatment is the first cleaning of the tract. That means the cleaning of the sinus tract, then the removal of the wall. Here we know in the pilonidal sinus there is the hair present. That means in case of the pilonidal sinus there is the hair present. Within the pilonidal sinus there is the hair present, so we have to remove all type of the hair, and at the same time we have to remove the hair within the regular interval of time. That means no hair should not allow there for increase in size, and also there is the strict hygiene maintenance. So it is the first conservative treatment of the pilonidal sinus. And the second option is cauterization of the tract. The cauterization of the tract by the minimal approach. That means by the silver nitrate, we can apply the silver nitrate in the sinus tract, and that will causes the inflammation, and finally there is the healing of the tract. And second one is the laser coagulation. So the cauterization of the tract may be done by the silver nitrate or laser coagulation. So these are the conservative treatment. The first one is the cleaning of the wall tract, removal of the hair, exfoliation of the hair, and the strict hygiene maintenance. And the second one, cauterize the tract. And the cauterize the tract, it may be done by the silver nitrate or it may be done by the laser coagulation. Now come to the treatment of the acute exacerbation. That means when there is the pus formation, there is fever, that means the systemic sign present. That means the acute exacerbation of the pilonidal sinus, when there is the abscess. In this condition, what we can do? In case of all type of the abscess, the treatment is the incision and drainage. So incision and drainage, it is the main treatment of the any type of the abscess. So what we can do, abscess should be drained, that means incision and drain. But here the special point we have to keep in mind that the incision should made over the abscess, but it is the away from the midline. So this point is very very important. This incision should give away from the midline for the better healing, because we know in the midline there is the less blood supply. So we have to give incision of the midline, that means the away from the midline. And then we have to curate the granulation tissue, and we have to remove all of the hair, because we know the main pathology of the pilonidal sinus is the here is responsible for development of the pilonidal sinus. So first of all, what we have to do, we have to make an incision, then we have to curate the granulation tissue, and also we have to remove the hair. These are the normal treatment of a pilonidal abscess, and it may result in complete resolution. Now see the operation. Here we can see this is a pilonidal sinus opening. Here we can see this is the pilonidal sinus opening or pilonidal sinus, and what there is the abscess formation. So when there is the abscess formation, what we can do, we have to incision of this pus, but keep in mind we should not give incision in the midline. So just away from the midline, it may be left side, it may be right side, so we can give an incision, and after that the drainage of the wall pus, then the cauterization of the granulation tissue, or the granulation tissue should be removed, and also here the hair present, so hair also removed. So it is the management of the acute condition. So again, see what is the treatment of the acute exacerbation of the pilonidal sinus. The treatment, first of all, an incision is made, and the incision is the off midline, that means it is the away from the midline. And the second one is the curettage of the granulation tissue, and third one is the removal of the hair. So off midline incision, curettage of the granulation tissue, and removal of the hair. This is the treatment of the acute exacerbation of the pilonidal sinus. And what we have to do, we have to do then the regular dressing. So this incision should kept open for the regular dressing, and when regular dressing done, this wound will closed time within the time. And what is the option for this, that means the opening of the pilonidal sinus? We can remove the pilonidal sinus by giving the incision. So the pilonidal sinus, it should be removed and dressing done in the lateral side, and within this time it will heal spontaneously. Now the surgical option, I think surgical option, it is a large option, and it should be discussed in another lecture. And here we can see this is the surgical treatment option of the chronic pilonidal sinus, and this snapshot also taken from the Bailey and Love. So the surgical treatment option will be discussed in the next lecture. Thank you.